Welcome to today's webinar. Today we'll be discussing IV medication management software for integrative practices. Thank you so much for all of you guys to join, and I'm really excited to introduce Justin Raithel. He is the co-founder of Revolutions Naturopathic. He's here to discuss drip IV ordering and administration and how it helps his practice save time, reduce error, improve his charting, and more. Now, if you guys haven't heard of drip, drip is the latest in charm integration. It allows doctors to easily order, administer, and chart IV therapies, and it was created in partnership with Revolutions Naturopathic. With this add-on, charm users can efficiently order injectables and cut down their administrative and supply costs of utilizing IV therapies. Justin will go into what we'll be discussing, but he'll be going into custom protocols, treatment plans, how you'll manage your IV administration, the integration with charm, and more. On this webinar, we will have Ramesh Donta. He is the co-owner of Dossier Systems, and he will be your software go-to person for any drip questions, technical questions that you have. So right away, I'm going to go ahead and introduce Justin Raithel. He is a licensed petroleum engineer. Justin, you've worked all over the world, United States, Europe, Africa, and your focus has been on efficiency improvements, right? As a petroleum engineer, you want to say a little bit about yourself?
Correct, yeah. So I've worked as a petroleum engineer. That's what I did for my first career, and got into the medical industry with my ex back in 2014. We founded Revolutions Naturopathic, and we've grown that to 9 doctors today. And we'll go through a little more history, but really my focus has always been on operations and how to make things more consistent, more efficient, and require less man hours to get the job done. Revolutions really has done IV therapies back since their founding in 2009. We started off, with just a couple of people in the IV suite, and tried to figure out how to make IVs run safely, efficiently. And that's where we really started developing the system back then. So we used an in-house system for many, many years, and would have folks come over and visit our clinic and try to figure out how to, use our custom homegrown system to help out other clinics. And it was really tough. And so that's what's really driven the formation of drip and Dossier is in order to provide this service to other clinics. So we knew it had to be web-based. We knew it had to be integrated with an EMR. And so we got together, myself as a business and user experience guy, Ramesh is the software guy, and then Rob is the hardware and support guy. And they've all three of us have different experiences in these backgrounds to bring you guys drip. So we partnered with Charm, and then we also are doing conferences and partnerships with Revolutions Naturopathic in order to train folks on efficient IV operations. All right, so just the homegrown solution. We used the homegrown solution for many years while we perfected the process. And you can see here the kind of fundamentals of it are base protocols, being able to prescribe a series of protocols and administer that to patients. So we have injectables of different amounts that we can add together, different bag types. And so this was kind of the first pass at this homegrown system that has served us very well, but couldn't really expand to serve multiple clinics. So our industry experience, integrative practices do use a significant amount of IVs as a treatment modality. And traditional EMRs just don't handle compounding well. It's not something the medical industry, the traditional or conventional medical industry does a whole lot of. And so what we found is that EMRs don't handle IVs, IM shots, tinctures, any of these things that are adding multiple ingredients together and being administered to a patient. EMRs just don't typically handle those well. We've also found the injectable supply industry is very fragmented and often changes. Part of it's provided by compounders, part of it outsourcers, and part of it the commercial injectable industry, which can change and often has just one supplier for some injectables. We've also found that running multiple data repositories reduces efficiency. So this is really what's driven the integration with the EMR. We didn't really want a standalone system. We know that chart notes really wanted to end up as the master repository in the EMR. So we're looking there and the patients are seeing that final chart note ending up in the electronic medical records. So we didn't want to, our original system had patient information in both sides of the system, which did lead to data discrepancies. So the integration eliminates those. And then the Charm is the leading EMR provider for integrative practices. Revolutions has been using Charm for many, many years and has worked with Charm, and Charm's been very open to innovating with the integrative industry. And I'm driving forward, the development of their EMR. So that's why we started with Charm, and why we felt this partnership was a really good thing for practices and Charm users. We've also seen many practices stop doing IV therapies just due to the administration expense and frustration with sourcing injectables, expiring injectables, and ordering those and charting those. So we've got our drip workflow. We've split it up to where we can manage it on both a desktop, and you see these large icons on the first screen, so we can also use it as a tablet as we walk through the IV suite. So in here, we've got inventory management, base protocols, IV prescribing, and IV administration. But we'll go into this more in detail in the demo. But I'm just going to walk you through kind of each section so you understand the whole thing before we dive into the demo. So from Charm, we're going to pull patient demographics and appointment details into Drip for that day, and then we're going to go ahead and push back administration notes and also the protocol details. So IV prescribing, we start with a base protocol. So in here, we can store a standard protocol, and we can have these at the doctor level, the practice level, or the official level. So we foresee having a set number of official protocols that are included in the initial software, which are the kind of standard industry accepted protocols that are there that can be used after some training in IV therapies. We also have the ability to do an osmolarity calculator, and then we have the ability to not mix, have some restrictions around injectables that shouldn't be mixed together for a patient safety standpoint. IV prescribing and workflow, we've got protocols, and then we move over into patient treatments. Oftentimes, and this is one of the challenges we had with our original system, and one of the challenges we see in IV suites at multiple clinics is things start to get confusing when we have multiple bags, multiple drip rates, and multiple treatments that are administered on the same day. So in here, we have patient treatments in that center panel where we can combine bags and change orders of those and have different administration directions. And then over on the right side, you'll see our treatment plans. So our treatment plans can be ordered, reordered, and so this is kind of an order of when we would expect the patient to receive those. So the first treatment at the top, next one in the next order. And then we'll see in the demo also, we see a history in here of what the patient has received in the past. We also have the ability to mark down when the patient needs a lab or a follow-up. Oftentimes doctors will want to see a patient after 5 treatments or 10 treatments or some number of treatments in the future, or they may want to check labs at every IV. They may want to check at labs every 5th IV. So we allow them to put those lab restrictions in here. Then the other thing we've seen is a time horizon that doctors request as far as lab expiration. So in our clinics, we'll see doctors approve patients to receive IV treatments for up to 3 months, 6 months, 1 year. It can vary by patient. And so we have this idea that we can put in when their labs are expired, and then the system alerts us that the patient is due for new labs. So IV administration, what we have is we'll have label printing for the individual bags. So this is for patient safety and efficiency, so the doctors can bill directly from these labels. And we have chair assignments for monitoring. We have a chart note integration with Charm. So we're actually going to walk through charting today, and you'll see what that looks like. And then we have a pre-built inventory management, so we can reuse our multi-dose vials and discard the preservative-free vials at the end of the shift. Because this is another thing for patient safety. We've seen that those preservative-free vials, we really need that reminder at the end of the day to go ahead and discard, or at the end of the shift to go ahead and discard those preservative-free vials. So in here, you'll see the appointments that are pulled directly from Charm. And like I said, I'll walk you through this workflow in the demo. So our finished chart note, which gets pushed directly to Charm from Drip, you'll see it here. It gets put in here with the prescribing doctor, our start times, our monitoring throughout, pre and post vitals, who is doing the stick and who is discontinuing the line, and then our standard chart notes as far as drip rate, when we checked. So I'll walk you through how we build this chart note out. And this is customizable too by practice. So. Chart note's also going to include our treatment name, injectables, and our lot numbers. So inventory management, in here we have the basics of our inventory, the strength, the size, what type of, whether it's multi-use or not, and osmolarity. And then we also have an ability for primary, secondary, and available suppliers to keep track of what we would use. We are just launching Drip this year. But what we envisioned is having a community of Drip in order to be able to work with suppliers to get constant updates. So we're constantly updating the system. So in 2021, we expect to partner with a number of suppliers and have the kind of regular updates, weekly updates to show what's available at what compounders and what outsourcers, because we know this can often change. And then you see those do not mix tables at the bottom that they could be put in. To not mix with certain other injectables. So our inventory management, our usage-based algorithm keeps supplies in stock and reduces waste. So this looks at our past use in order to predict our future use. We have lot tracking for patient safety. We have an inventory check-in for loss reduction. And then, like I mentioned, we're going to do continuous supply updates moving forward. So customization, we have role-based permissions, similar to what you're used to in Charm. We have different options for administration, catheter pick, and port. We can handle multiple facilities in one practice, and then we can just pull over specific appointment types in Charm. So our pricing is going to be $20 a month and $1 per IV administered. We are doing 30-day free trials if you sign up in 2020. So you can find more information at our website, dosearraysystems.com, and you can register at drip.dosearraysystems.com. Also wanted to let you guys know, in partnership with Revolution's Naturopathic, we do teach IV administration courses in our facility in Roseville, California. Next one coming up is January 30th and 31st. If you go to revolutionsdocs.com, you can see and register for that next clinic that's coming up. All right, we're going to go ahead and hop into the demo now. All right, so when we first log in, we'll find our facility here. So if you have multiple facilities, you'd see 2 facilities. I'm just going to dive right into each section. Obviously, the doctors that would be using the system, they're typically going to be using IV prescribing and IV administration. I'm guessing a lot of the folks that are on the call today are on the doctor side, but the staff side is going to be over here in the IV inventory management and IV administration if they do some of the prep work for the doctor. So I'll dive into inventory management first. We have a place where we can keep track of our suppliers, some basic information for our suppliers that are here, contact information, websites, these sort of things for quick access. We can also upload documents in our suppliers if we have price sheets for them or different ordering sheets that we'd like to use for them. We can store them here in the system for easy access. Injectables, we've got a set of injectables that are loaded in here, and we have, like I mentioned before, we put in our strength, we put in our supplier details that are here, and we can also mark injectables to not be mixed. And if we mark them to not be mixed, they can't be added into the same bag together. And this is customizable by practice. You know, doctors, we recognize that the doctors do different things, although there is a standard case that we will put out there. We do recognize and give that flexibility to the individual practices. And so certain practices, if they want to be more restrictive on what they mix and what they don't, they can enable that in Charm or in Drip. IV bags, pretty simple, size, strength, osmolarity that's in here. And then we have our reports. So we can run reports for what we add, our current inventory, and an injectable order that's here. So I just added some simple inventory that's here. And of course, whenever it's running really well, it pulls up that current inventory. When I ran it just a second ago, it ran really quick, but it does take a little bit because it goes back into the history to pull everything out, what's been used, what's been added, and adds those all up and shows us our amount remaining in mLs that's associated with that specific injectable, where it came from. Moving on into base protocols here. We've just got a few loaded here in our sample practice. These are all loaded as personal libraries, so my own personal, so they'd only show up for me. If I wanted to, I can switch them over to a practice and update those, and we can restrict this to just the lead doctor at the facility can upgrade those, or the office manager. So we could have that restricted to where doctors that are newer wouldn't have the ability to share practices with the entire practice without somebody else approving that. So then we have practice level and personal. When I go in to prescribe, I'm going to see all of these protocols together. But if another person were to log in from the facility, that would be a doctor, they would only be able to prescribe these practice protocols unless they created their own personal ones. The only other thing I'll show you is what a base protocol looks like. So we'll go through this more in detail on the patient prescribing side because it looks exactly the same, but you'll see this base protocol that's in here. The reason we do base protocols, the reason we did it originally in our first software was it allows for a very consistent starting point for patients. So here's our base protocol that's pre-built for us, ready to go, and I can go in and modify for patient-specific changes. But I'm always starting with the same thing. It's a quick way to order an IV. And it gives me a standard duration, standard bag type for my specific clinic. So going over to IV prescribing, I'm just going to check the chat real quick to see if we've got anything else here. Okay, nothing on the chat yet, but if you do have questions, feel free to chop in there. I'll try to pop back over there every once in a while. So if I pull up, I'm actually going to start with a patient here. So if I pull up a patient from the very start, what I'm going to see is everything has not been populated. So I have over here my base protocols that I can start with. So if I start with a nutrient protocol for this patient here, I can go ahead and add that here and I can see what all injectables are there. So if I save this protocol, I'll see this is now in this specific patient. So for Mr. Fake Patient that's here, we can see that the doctor has prescribed a nutrient replenishment protocol. If the doctor didn't want that base protocol to be just a standard one, they could go in here and for Mr. Fake Patient, they could adjust the amount of different injectables that are here based on this patient's specific needs. So when I do that, it's going to adjust the osmolarity. They could also change what's going on for this specific patient here and what sort of bag type they were. If they were to change it over, if the osmolarity is over a normal osmolarity, it is going to warn them. Doctors do administer, as I'm sure you guys all know, a higher osmolarity. If it's in a very low osmolarity to where it's dangerous, it does turn red. So this one here, we had lactate ringers. We can also change the size associated with those. Let's look here. We could change the size in there. And so we're going back to 250 lactated ringers is what we had before, but we did update this for the specific patient there. All right, well, once we have a protocol in there, I could add a second protocol in for this patient. We could start with a glutathione push that's here, add that over to this patient. If I wanted to also, I can go ahead and duplicate for these patients also. So I can go ahead and duplicate this protocol and add this into a higher dosage that's here. Oh, normally I can duplicate this. I did just create this new practice this morning.
Justin, sorry to interrupt. You want to change the name.
Oh, thank you. Thank you. So higher dose. Thanks, Ramesh. All right, so then we can go ahead and put in these protocols here for this patient. So in a treatment plan, I can bring these together. So I could start with a nutrient replenishment and a glutathione push. And then the next one for another treatment, maybe after that, I'm going to go to this nutrient replenishment and a higher dose glutathione push. So it's going to name these protocols based on how I put them in. So if I wanted to do the glutathione push first, I could go in here and put glutathione push first and nutrient replenishment afterwards. If I do that, it's going to reorder them here. I also have the ability to customize name treatments if I wanted to, and I also have the ability to shift how these bags are administered in here. So if I wanted to, I could call this Dr. Bill's protocol or treatment. Typically what we've found at Revolutions is if we've got multiple bags, we leave the name based on those bags that are there. So it's very clear in which order the doctor wants them administered or which dosage they want to be administered. So in here, if I wanted to go back into that, I think if I delete that, I can go back to glutathione and nutrient replenishment. All right, so in here, if I wanted to just do this as a starting dose here, I could bring this one and just over into the treatment plan as one. And then if I wanted 5 treatments after that of this, we make it very easy to bring those over. Because we know oftentimes doctors will use the same treatment in a series, and then they'll oftentimes want to run labs or a follow-up at the end of that treatment. They could also put in an expiration date of when this patient last ran labs, go out and say, well, I'm comfortable going out until January 15th, 2021. Whether the patient completes these or not, we need new labs on January 15th, 2021. So that's how we put in protocols for a patient.
Justin, I think there are a few questions you want to just hop over to.
I will hop over right now. Thank you, sir.
Does Drip run inside Charm or alongside Charm? Is it a separate app with its own login, I think?
Correct. Okay, so it is a separate login from Charm right now, and it runs in a web browser. And so you can see here, what I have is I have Drip open, and then over here, I have Charm open. So Charm's going to handle the scheduling, the billing, the final repository for the chart note, the patient portal. All these things are still going to be in Charm. The only thing Drip is handling is the administration, the ordering and administration of the IV and the injectable and bag management of inventory. Do you have consents embedded in the system? We do not. We are using Charm for the consent forms that are for patients.
There's a question from Laura here.
Yeah, I got that here. Okay. Yes. Can the prescriber order a series of the same infusion, for instance, 1 IV weekly for 5 weeks? Exactly. Yes. So you could. So what would happen is the 1 IV, like I did here, for 5 treatments here. And 2, is there an ability for RNs to place orders for providers to then be signed off by the provider? We do not have that ability yet, but we can definitely add that to the roadmap. So if I wanted to also, I could pull over, say I am occasionally going to do a vitamin C for this patient. I'll just use this as the name is significantly different. Pull this over into the treatments just by itself. And then if I had this over here, if I added, it's going to be added to the bottom. But say I wanted this patient for their next treatment to get the vitamin C instead, I can go ahead and move that up to the top of the order. And it's going to go ahead and sort that treatment plan. So when I go over into administration now, this is going to be the next treatment that Mr. Fake Patient is going to get. And I can put this in here anywhere, and it will resort the order that's associated with it.
Another question that gets asked is, after a treatment plan is put in place, if doctor wants to change, let's say, vitamin C, instead of 25 grams, they want to add 50 grams, does it go into the treatment plan? Or, I mean, like, whichever treatment plan has vitamin C, does it automatically update the amount the doctor may have changed? That's another question. Yeah, the answer is yes, it does.
Does it automatically update? Oh, if I went over here and I modified this protocol?
Yeah, exactly.
Correct. Yeah, so if I went over here and said, I don't want this patient to get this, and hit save, that's there. We now have a 50 gram that's here. And we can move that over to that.
The exact amounts will be moved. The treatment plan will have automatic adjustment.
Yep.
Okay. There is one more question inside the chat.
Okay.
How does inventory work for multi-facility clinics?
So the inventory is handled at the facility level, not the practice level. So the inventory is separate per facility. All right, so we're going to go over to administration, and this is where the system starts to look really slick and saves us some time with charting. Right now, what we've used at Revolutions is we've used SOAP notes. And so I'll just kind of walk through kind of a standard IV day that I've mocked up in our demo practice here. And so our standard at Revolutions would be a patient every 15 minutes that's in our IV suite. We do group them together so we can lower the cost for patients getting IV therapies, because there's just one doctor or one nurse that's in there that is running the administration, with support from others. So in here, the patients are booked for an individual IV treatment. And then how we're running it right now is we also need to put in billing for these patients. So we go over and we start the encounters, and we go ahead and put the billing in for these encounters. And I'm sure if you guys are doing IVs, you're probably used to this already, but you can start an encounter. You can go over to procedure codes. And so our staff actually takes care of this portion. Jane's getting a vitamin C. And so we can go ahead and put that in as a procedure code. And then we're really done inside Charm until we push that chart note over. You can see here we have patients all on the schedule. When we go over to DRIP, what we'll see is which patients already have treatments prescribed. So when I'm pulling this up, our staff looks at this the day before for treatments, and we go ahead and make sure all of the staff all of the patients that are coming in the next day have a treatment that's assigned to them. Sometimes we do have patients that don't get a treatment assigned to them until they come in. And in that case, we know, because there's a blank that's here, we know eventually we're going to have to go back over and we're going to have to put in a treatment that's associated with here. But I can go over, pull up that patient, and go into what you saw before is their protocols that are already approved by the doctor and their treatments that are already approved by the doctor. And I can move one of those over into the treatment plan based on what that patient needs that day. So I can have multiple options already prepped before I can go over and add something to the treatment plan. So in here, what you'll see is an ability to, I kind of started this one already today, just so you'd see things at different phases of the administration, but I'll walk you through what one looks like. So here's this person here with nutrient replenishment and glutathione push that we added earlier. I can go ahead and print that label for this patient that's here. And this is going to print off 2 labels. So we're going to see labels for nutrients and here, glutathione push. So what we end up with is 2 labels. We use 4x6 labels. It can be printed out of a standard printer, and you'll see the protocol name. You'll see it's bag 1 of 2 that's here. You'll see the drip rate. You'll see all of the ingredients, any technical notes that the doctor's added, an osmolarity that's there, and a total volume that's associated with it. So you'll see that for both of these with the notes here from the glutathione push. And so I can go ahead and hit print on this, and it would go out to a printer, print me 2 labels. I can attach those to the bag, and they're all set and ready to go. So those labels, after they're printed, patient shows up in the IV suite. We know their billing's already in. We know their label's already printed. Doctor's built their bag and we're ready to go. Then we can go ahead and start putting in the chart notes. So we're going to put in our chart note that's here. We're going to get basic vitals on them. We're going to assign them to a chair. We can add in any notes that the patient tells us that we want the doctor to see later. So, if we want to add anything in here, check in, follow up next week. We can put in anything we want here. We also have in here that they've eaten within the last 2 hours or we provided a snack. So as we step through here, we've now put in basic vitals. We can go ahead and start the administration of the IV. In here, we can put who placed the catheter or the Huber needle or connected to the port. So we also have sterilization methods that are here as default for the chart. And these infusion methods are customizable by the individual practice. So if you guys use a different size Huber needle, if you flush differently, if you have different things that you want in that chart note, then it's available there. We also see the protocol that's being administered today, the starting drip rate for the first bag, and some defaults of checking so that it gets charted. We also have failed sticks in here for a chart note. I see some questions popping up here, so I'll give it a stop here. And the question is we're a facility that has naturopathic physicians whose orders need to be approved by the medical director. I assume this feature is not available, as you said, with the nurses. I want to mention that we're also interested in this feature. So we can definitely add in order approval to the workflow process. And let me look in the chat here. So if the bag is made in advance of the patient's arrival, but the patient does not show up, do you charge the full price of the IV? That's up to individual clinics. Revolutions does. And we do have the option. So we actually start taking the materials out whenever the IV is started. So if somebody is canceled and only the label has been printed, it doesn't necessarily remove that inventory from that. And so that's the way it's set up right now in Drip, because we had this issue of Revolutions where sometimes we get the bag, we print the label 4 hours in advance, patient cancels 2 hours in advance. And so we don't need to necessarily pull those injectables used out of the system because the bag was never built. So in that case, if we just print the label, it doesn't pull that inventory out of the system. So then we go ahead, and this patient was started a few minutes ago. When I click monitor, it's going to update to current time. It's going to default to the person that's logged into the system. And so you're typically, what we have is a medical assistant that's logged in, carrying around a tablet. It's going through the IV suite and going ahead and confirming that everything is running according to plan. The doctors can also do this. They could have a separate tablet for their login for anything they're going to go ahead and check. And this can switch back and forth in the chart note for how this is being monitored. So I go ahead and click monitor here. I'm going to hit view so you guys can see that the chart note is being built. So here's the vitals pre that's in here with the notes to the doctor. Here's the start information. Here's the monitor information. So if I go back and need to change anything, I can go back and start. And I can say, actually, we did have one failed stick today. So I can go back and edit this chart note. So now this says failed sticks 1 as I'm building it out. So the chart note doesn't get pushed to Charm until the very end. So I can keep building this chart note out in Charm. So normally I don't click monitor again for another 15, 30 minutes. You know, protocols will vary depending on the clinic you're operating in. But the next time I'm available to monitor, it's going to update to this most recent time. All I have to do is click monitor, make sure the drip rate there, we're not leaking, we're not infiltrated, swelling, or bleeding. And then this is going to go ahead and build out this chart note here. So this is just really, hey, we're monitoring the patient, we're going through the details, we're doing our due diligence as those that are administering in the IV suite, and making sure everything's running according to plan. So now we get to the next item we want to do. So we want to go to, if you see here on switch protocol is at the bottom of each of these. That's because our protocol is on one of two. We have a second bag that's associated with it. So I have a line switch or a bag switch option. So line switch would be we change out the entire line. Bag switches, we just change out the bag for that. So for this one, we're going to move to a push for glutathione, which means we're going to go ahead and do it through the side port push. So we're going to go ahead and do a line switch that's there. And then we can move into monitor here for the glutathione push. It's going to give us a different drip rate based on what we put into the system. It's going to go ahead and monitor that time. We can go ahead and do this. And so we can do second bags or third bags in a similar sort of format. And then after that, we would go ahead and hit end monitor. And that's going to move us into post vitals that's associated with it. I see a couple more questions popping up, so I'll pop over to the chat here. So to use a device tablet, does that require a login separate from the doctor's login? We would recommend that we do use it separate from the doctor's login because it is going to default for who's monitoring that patient. If they're both logged in as the doctor, they would have the same privileges as far as prescribing, so we don't recommend that. We do recommend having individual users have their own separate logins and different role-based permissions. So using a tablet, it is in a browser and not an app. So that's where we have right now is a web browser. We use iPads in our facility, and it does work well for this administration screen that's going on for using that. Nutrient resistance doesn't reach individual. So one more question. I see in the chart note that it simply says nutrient replenishment, but doesn't list each individual nutrient. What if the nurse doctor omits one of the usual nutrients that's usually in the protocol after it has been ordered? Is this noted anywhere? So once it's ordered and we print that label, then it's static. And so that's why we don't show any injectable ingredients after that in the system, because we don't want to pull something that's been updated. Once that label's printed, it's on paper, it's on the bag, that's what's going to be administered. If the nurse or doctor decides to omit one of those nutrients, they would need to give that feedback back in one of our notes sections in in here. So most of these have a notes that's associated with it. So they could put in here, I decided to leave out if you give the ability for your nurses to modify protocols or the administering doctors the ability to modify protocols, they could leave it in a note like that. Obviously, the best practice would be to go back in and adjust what's been prescribed and then go ahead and pull that over and cancel the administration of the other one. And then I can go ahead and put in post vitals. If I don't put anything in here, it just says post vitals deferred. And then I can go ahead and hit end on this one. This is going to have my whole chart note. Forget what I put as the initial, but it's going to save that. If it was port that I had on the first one, it should save this going forward. And the patient tolerated the procedure well. When I go ahead and hit OK, now I get this nice internal error. But what it does is it pushes that note over to the practice. So I just created our demo practice today. So we'll see what went over this morning. And make sure we have a chart note. If not, I'll show you the sample chart note that we have there. And yeah, it went ahead and pushed that over. So you can see in Charm, this patient that was here goes ahead and gets all of this information that's pushed over today. So if I added the note and I decided to leave out the methylcobalamin today, it would be here. We have end notes here. So this all goes in the treatment notes section that's associated with that. And you see these different drip rates based on the bags. And then in our facility, what we do is we go ahead and click File for Review, and we file this for review with the prescribing doctor. So they can review and sign the final chart note. And I see another chat note in question. All right. So with this here, this has been administered, and that chart note's been pushed back to Charm. We go to end shift. What this is going to do is it's going to look at what's preservative free and what's multi-dose. So for our ascorbic acid here, we see a size that's here. We've used 18 mLs today. So we have 82 mLs that need to be discarded. It's going to default to yes for that discard. B complex is a multi-dose vial. All it's going to do is register that we've started using this vial with this lot number, and we're not going to discard this by default. So when we hit save, it's going to go ahead and pull out everything we've discarded today or everything we've used if it's a multi-dose vial. And it's going to keep track of that for ordering in the system.
So I had a quick question for you. Would you be able to show how the practices can use Charm to invoice and share the visit summary to patients?
Sure. So in this patient here, I put in here, we can go ahead and edit this treatment here, and we can put in a procedure code. So if we hit save on that, that procedure code is then would be billed out to that patient. And so when I go over to billing, I have this all ready, and I can go ahead and create that invoice that's there. It's going to show that procedure code that's there, and I can approve that and go ahead and take payment for this patient.
Very convenient.
Justin, do you want to quickly show how inventory is received? There was a question, I mean, maybe 1 minute, just one demo we missed. In the injectables, receive inventory, that green button, very, very quickly, if you could show it.
Sure. So inventory, the way we receive it, when we go into injectables, if we get new inventory, we've got an option of reviewing it, receiving inventory, viewing inventory here. So I can go ahead and hit receive. What it's going to do is it's going to tell me what I'm supposed to be receiving. So this is another patient safety and also a cost control measure is if the ascorbic acid I received is not 500 milligram per ml, it's not 100 ml, and it's not preservative free, then it's come in and it's not correct for our facility. And so we should alert an office manager or our head doctor so we can resolve that before we put it in the system. So we confirm that that's the information. We can go ahead and put in an expiration date for that that's coming in there. We can go ahead and put in a lot number that's here. We can put in how many we received. And then if we got it from a primary supplier, that's what it's going to default to. But we also have our secondary suppliers here if we want to use those. When we hit save, that's going to go ahead and put in here our inventory that's associated with it. So you'll see that last lot that came in. This is the one that we're going to use first. It's got this remaining mLs because we didn't actually discard that last bottle. When we end the shift today, it would drop to 2,400 or some round value of 100 because these are preservative free. And then it's going to be using this lot until we run out, and then we move on to the next lot that's here. We also have the ability to run lot queries. So if we find that we have a recall or if we find an issue with a lot, we can go in here to reporting and we can run a query of every patient that has received that lot, and then we can appropriately deal with the recall.
My other question was if you, how you pull the appointments and patient info from Charm to Drip. And
so in here, what we do is we pull in, when we go to our setup function in Drip, we have a set of preferences here. And in preferences, we'll see visit types. And in our visit types, we can choose which type of visit types are brought over when we do that query over into Charm to pull over visit types. So we know some practices have dedicated IV calendars. Other practices will put them on a specific doctor's calendar, but they'll code them as different visit types. And so we wanted to be able to serve both options. And so with a visit type of an IV or whatever you want to call it, we allow you to make these choices to say, here's what I want to have brought over into drip.
Ranjini, we decided to start with Charm because that's the leading EMR provider in the industry, especially for the clientele that we are serving.
Wonderful. Yes, it's a really wonderful integration, and I see a lot of interest from our attendees. Before the end of this year, Drip is offering 30 days free, and it's a good time to kind of try it out and see if it works for your practice. Try out the Charm integration, see if it works the way you were expecting, and I think in terms of like increasing efficiency and potentially. Justin, I'd like actually to ask you at this moment, have you seen, just with the increased efficiency and organization that this has provided and maybe a better workflow for you, have you seen a change in your revenue or in the way, or like some sort of translation into how it's, changed the way you run your business with the IV?
Sure. Well, we were moving from a system that was homegrown, right? So we had some of these efficiencies already. But we do see definitely a change with the charting workflow. That's the big one for us because we already had the ability to order and prescribe in our old custom system. But with that ordering and prescribing, we had some issues with our old system that are much, much better in Drip. So we get some efficiency gains there. But the big one for us is the charting. So we're pushing those chart notes back so we're not having to go in and use a SOAP note to go ahead and input all that information back in.
Into Charm.
Oftentimes, if we have a busy IV shift, the staff or the doc is staying late in order to get all the charting in and get it all caught up. And now when the IV shift is done, they click a button, all the chart notes are already put over. And so you're really doing live charting as you go along. And so it makes the end of the shift much easier and much less stressful.
Absolutely.
Actually, Justin, I answered a question online. I wanted to answer here. A question about who provides the support. Does Charm provide or the Drip or Docere provide? The answer to the question is Drip provides the customer support for this application.
And just like any other add-on within Charm, you would go into settings and go into add-ons, and this would be another add-on as an integration into Charm. So within Charm, you go under settings and go ahead and click on add-on, and you'll be able to add in your Drip integration.
Justin, another thing is in inventory management, I heard that that is a big efficiency, like productivity, as well as the cost savings as well to facilities. Is that right?
Yeah, so we have used our system from Revolutions, and we go over this in that course that we teach about every 3 months. But the idea is we are using our past inventory, our recent past inventory, to adjust to how doctors are changing their prescribing. So we tend to keep 60 days of supply for compounded injectables and 120 days of supply for commercial injectables. And so that's what we're basing the inventory ordering off of in Drip is looking at that past. Obviously, there still has to be some human interaction with the injectable ordering and getting those orders out. But it can be quite a large time suck to try to use standard amounts to keep on hand. And so this really updates with each month how you're using IVs, and it lowers costs too because you're not having things expire on the shelf. As I'm sure you all know, compounded injectables don't last very long, so trying to make maximum use of those is really important to keep costs low and affordable for patients.
Wonderful. Thank you so much, Justin, Ramesh, and Rob, all of you for being here present today. Thank you all attendees for being present here for this webinar. Very exciting to see. I think many of us post 2020 are looking to see how we can advance our practices, and I think this is one great way, one great integration to add in to increase that efficiency.